My dear friends, good morning and good afternoon. I don't know who are you now just listen to my talks. Where are you come from? What are your profession? But in the face of the epidemic outbreak of COVID-19, we are same. We are soldiers. We have to fight to novel coronavirus because we are doctors. I'm Dr. Jie Qiao from Peking University Third Hospital as a gynecologist and obstetrician 39 years, and as the president of this hospital 8 years. Now I have another title. I'm a team leader of National Medical Team's support to Wuhan from Peking University Third Hospital for 66 days. Speaking of China, maybe you're thinking about Beijing, Shanghai, Guangzhou. Actually, Wuhan is also a most beautiful, flourishing, prosperous big city. But from the end of the 2019, Wuhan suffered a disaster, huge disaster, as you know, because of COVID-19. Every time I see this picture, I cannot control myself, burst into tears, because this city locked down from January 23rd to prevent the disease from spreading to other regions. And many people suffered the disease, and other people strict isolated. Not only for Hubei, for China, but also for Earth as a whole, for human being. They suffered a lot, but now they stand up again. Just like we are often told, no winter will not pass, no spring will not come. I arrived this city February 1st because the number you see at that time confirmed the cases about 2,000 and 6% increased. That is the early stage. Some patients waiting for treatment didn't get the diagnosis immediately, and during 1 month, more than 42,000 rescue medical team members from the other provinces of China go in Wuhan to support. My hospital sent 3 groups to Wuhan. From January 26, what we do go in Wuhan. Actually, one hospital need management, one critical air cases ward. Like example, Tongji Hospital just need to changing general hospital to isolated ward, 11,050 beds. My hospital is one of ward with management 30 beds. What we need to do first, changing the environment. Like this, you can see this the huge fan. What meaning this? It's very important. This big fan, strong energy, changing airflow. Actually, no exactly ICU negative pressure isolation ward, but we have to protect the medical health worker and also the patients. And other things we need to do, like here, you need to sealing the crack between a door and its frame. Because here will become the isolated ward, and other space behind the door as the clear district, and doctor and nurse can work and rest sometimes there, but need to protect and even find the gel as difficult to sealing the glue to sealing the cracks. And things we need to do to find this in general condition is easy to do, but at that time also difficult to find the central monitor and the breathing machine and like arterial blood gas analysis. But all is very important, isolated how the equipment need to use. And other things we need to do as the training, protection training for the staff. In only Tongji Hospital, Sino-French branch, we have 23 national medical teams, nearly 3,000 medical staff. In PKU 3 hospital, more than 400 medical staff. My hospital, 137. I told about that because one ward, 50 beds, ICU beds need one beds need 1 doctor and 3 nurses. Of course, it's not enough, but at that time that's okay. But actually, at that time, we also have not enough PPE, and we take 7 days from Beijing to Wuhan, but it's not enough, and we try to protect the medical staff then can continue to work is important. So first, I need to training well how to wear the gear, and also I read glass, protect glass, and so on. And like you see this slides, we are staff, physician and nurse coming from the different departments and know more experience for the infection disease and ICU, so need to training well. But of course, it's a good thing is have MDT background and good for the cooperation for treatment for some patients have the underlying disease. And we set up the promote MDT cooperation team even in Beijing and also between the different hospitals. So you can see from February 1st, I arrived there. Of course, before that, I also have some cases and more medical staff come in Wuhan, and then recovery patient 2 months quickly recovery and came back to home. And finally, we back Beijing in April 6th. You can see the 3 water canal give us a highest honor to heraldic team and even the snowball. Of course, the stage defense is good, but we need to reflection thinking about because every country you already know the pandemic situation of COVID-19 worldwide, and what can we do? And another thing is the asymptomatic infection, and also as a big potential challenge, because some specialists think nearly 50% of patients infected with the virus as asymptomatic carriers. So things we need to do, and we need to know more about the COVID-19, and we already know some about the etiological characteristics like human respiratory epithelial cells. The COVID-19 will exist about 4 days, and also the virus is sensitive to the ultraviolet and heat, and the source of infection as patient infected, and the route of transmission, mainly through respiratory droplet and close contact. And so we can protect ourselves for wear the mask and hand washing. And we also gradually know more treatment about that, like a Chinese clinical guideline of COVID-19 pneumonia diagnosis and treatment, the 7th edition. And we know the prognosis for the pregnant woman similar to the same age group, and and the severity of symptoms in children as relatively mild, but the prognosis of the elder person and those have a chronic comorbidity as relatively worse. And the typical progress of COVID-19 we already know, and 80% of patients have symptoms will recover, and just 20% need to go to hospital. And of course, most will recover, but the death rate, whatever 1%, 2%, or 4% in different country, but because of the huge of population, even as a very serious problems we have to face, and so many lives pass away. So we need to pay more attention to clinical classification, because even most is male, but some of them will become the severe or critical, and clinical early warning indicator of severe and critical cases is very, very important. And no good laboratory marks show us even the dimer, interleukin 6, or some others can tell us something from the illness onset to the patient condition changing. But what is the most important treatment? Also as isolation, oxygen therapy, supporting treatment. No really effective drug can help the patients. We try a lot of antivirus, antibiotics, and even corticosteroid, and immunotherapy, even TCM. But the pathologic changing of severe COVID-19 in lung, in other organs, gradually will be reported, but actually, because the complicated of the patients, some with the underlying disease, and we also need more research to know what is about that. And Chinese experts team have conducted a pathological, anatomical study and conclude if some efficient treatment procedure, but we also need the more effective treatment, and early intervention is very crucial. For example, the invasive mechanical ventilation can become a life-saving intervention for patients with respiratory and breathing difficulties. And the possible pathway to death and recovery in patients needing respiratory support can see from this slides. It's very important oxygen, invasive, non-invasive, and also ECMO, gradually saving the severe cases alive. And there's the critical patient with COVID-19 treatment. The road, I don't tell the detail, you can see it. Now we're changing to the experience for the maternal and infant protection during the outbreak of COVID-19. And actually, what can do at that time the government for maternal and infant protection is very important, like the strong management of government, because the outbreak, the pandemic, only individual doctor do is not enough. And the Chinese government do a good job in the pregnant women and children treatment, and you can see they release some national policy and technical guidelines for COVID-19 prevention and management timely, and for notice how to prevention and management infected pregnant women and children, and also the strengthening management of that. And in the latest 7th version of diagnosis and treatment guideline, also including the clinical characteristic and treatment and pregnant management of the pregnant women. And the second thing our government can do is optimizing the operation of MCH service system to adapt the changing situation during the outbreak. And we further optimize the operation of MCH system so that the fast changing situation during the outbreak and more targeted the service well provided to pregnant women and newborn. And we already existing strategy help us for screening and assessment of risk of pregnancy, and also management of the high risk pregnant woman and nearly missing pregnancy. And you can see the different colors show the high risk or highest risk of infectious disease already. So we can quickly move to COVID-19 targeted service, and for the lower risk and higher risk, use the different strategy and establish the revising service prevention system for screening, diagnosis, and treatment of the pregnant woman with COVID-19. And from the January 2020, actually, a bed is hard to find now, also like now some country, but gradually there is 50 designated hospital provide medical service for uninfected pregnant women in Wuhan, and also there is more than 1,000 designated hospital provide medical service for infected pregnant women, and in whole China, 5 of which located in Wuhan. So, like the general population infected up to March to 2020, have changing the condition. The hospital bed waiting for the sick people That means we have empty beds for that. That also is the reason for the April 6th we can come back Beijing, because we close already established the national ICU ward gradually. And very important thing is the isolation category for the uninfected or the suspected or infected pregnant woman. And for the normal pregnancy woman, home isolation is important. And for the regular prenatal examination, changing some policy depending the pregnancy period. And if suspected cases or confirmed mild cases, like Fangcang Shelter Hospital, in the beginning of the February, just changing some spot, stadium or hotel to cabin moving hospital. And that's a very important strategy can isolate the resource of infection and also cut off the transmission route and can close the observation of patients and can adjusting the therapy in time. And for the severe cases confirmed, and for the pregnancy woman, there is a special hospital be designated management by the national medical specialist team, can give the good treatment. And the third one for government can do is strengthening the provision of maternal and children health services through different channel and platform, online consultation, WeChat, and other social media app, hotline and video, and so on. And what can do the hospital for the maternal and infant protection? And that's what already done. As a different country have the different background and different condition, but we have to do something in the detailed things to prevent, not only depending the government let us do, we also need to try our best for like outpatient hospice. We monitor everyone temperature when they enter the hospital by using infrared temperature measurement equipment, and give the tips and guidance for the patients with fever. Ask them to go to the fever clinic and exactly let the patient follow the 1 meter line to prevent close contact, and ask to sit at interval. And also use a self-service registration machine for the interval operation. And for the outpatient department of obstetrics, it's important because a gynecologist patient can delay the operation of the benign, but for the obstetrician have to continue to work. So we expand the outpatient area of obstetrics and exactly strict hand disinfection. Yeah, before in China, not good job for the hand disinfection for the general population, and the sterilize of a central air condition system, and told the husband we are so sorry because we need to divide the population now crowded, so families are encouraged not to accompany women without indication. And for protection of the medical staff, provide the training and guideline for the medical staff. This how to even the doctor, even the nurse cannot face the infection disease in their routine work. So every staff have been training several times, even to wear the clothes. And every staff should monitor their temperature and report symptoms every day. And also warning for staff to keep distance when working, eating, and have a rest. And like various forms of network medicine and strategy for the regular prenatal checkout suggest pregnant women visit at a different time to reduce crowd aggregation and implement full appointment with doctor except emergency. And we also need to optimize the medical service procedure in the department, because in the hospital do the monitor, but because they have some time waiting for the hospital. So also we need to monitor body temperature when the patient going on the obstetric clinic, and the epidemiological investigation will apply to collect data by computers and smartphones, so on. And hand disinfection before see the doctor need to do again, and suggest pregnant woman visit at a different time, emphasize about that. Also need to emphasize the hand sanitizer, the gel provided for every people. And for the suspected and confirmed cases, first I introduced the Lancet published online 2 months ago. It's very important research, even limited cases. I also gave comments at that time, because they report non-confirmed pregnant women or in the 3rd trimester. You can see the mean clinical feature also is a fever and cough, have some complications for the fetal distress or preterm rupture, but also it's not very serious. You can see the 0 cases develop severe COVID-19 die, and 100% live birth. And these 9 cases had the cesarean section, and they tested 6 newborn for the SARS-CoV-2, and they do the amnio fluid, gallbladder, breast milk, and neonatal throat swab sample. All sample tested negative for the virus. So they got the conclusion: the clinical characteristics of COVID-19 in pregnant women were similar to those reported for non-pregnant adult women with COVID-19, and there is currently no evidence for the vertical transmission among pregnant women who developed COVID-19 late pregnancy. And also have some report from the pediatrician, and 9 mothers also delivery safety, and there is a 1 death for newborn is because the preterm, not because the COVID-19. And the others report from the Hubei is 16 cases. Also no significant difference in pregnancy outcome, and also no evidence on vertical transmission from mother to baby. And gradually more and more report for the suspected cases, treatment and diagnosis. So you can see this flow chart for suspected and even mild cases need in the isolated ward of fever clinic, and severe cases need ICU ward treatment. And for the COVID-19 nucleic acid test is necessary, and all need much attention, even the negative for the nucleic acid test. And for the positive, we need to transfer to designated hospital. And for the negative, with no indication of obstetrician admission, need to tell the patient home isolation and follow up as extremely high risk pregnancy. And with indication of obstetrician admission, also admitted to isolated ward in obstetric department. And for the management strategy for the suspected cases and also those confirmed cases who cannot be transferred to designed hospital timely for the obstetric department, usually easy to happen for the emergency. But we need to do some prepare in the outpatient area, need to isolate it exactly. And inpatient area, not only isolated ward, but also the table, bath, and important things is this four key point. The first is the epidemiology screening and the cloud computer and the big data approaches. And the fever, cough also is the main symptoms, and you do some blood tests, and if necessary, nucleic acid and CT scan can do. And if it's suspected, quarantine the patient in a special room as soon as possible, and emphasize things as need to MDT consults. And the second is management during the different trimester. For the clinical cause of COVID-19 is similar between the pregnant women and adults around the same age, but as special things need to pay more attention as with chronic disease or maternal complication. And for the drug use need to depending the different trimester. The fetus should be serious evaluation during the treatment, and no evidence to support the termination of pregnancy without the medical indications. And for the pregnant woman with severe or critical COVID-19 should transfer to the termination of should prefer to the termination of pregnancy, and the best choice is a cesarean section. And for the gestation weeks and adverse effect of drugs, pregnant woman and fetus should be serious evaluation during the treatment. And now as relative safe to use in the second and third trimester. After the first trimester, depending the symptoms of the patient, if high fever, need to patient's discussion and family for terminate or not. And because we know the choice of infected pregnant woman, how to terminate the pregnant is still conflict. We do prefer cesarean section than vaginal birth because the physical exhaustion during the labor will decrease the body resistance and also increase the infection prevention, because control difficult due to hyperventilation. And also if emergency cesarean section needed, infection prevention procedure usually hard to implement rapidly. So choice of delivery, whatever vaginal delivery or cesarean section, as important, need to have a special hospital, because need the emergency cesarean section in labor, need to prepare active cesarean section procedure or active labor procedure. Regardless of delivery mode, the most important things is infection control. Cesarean section contingency plan need to prepare first the personal division, better two groups of doctor contact and operation the patients, and need to dedicated road and elevators, disinfection procedure, and level 3 defendants of the medical staff, and clear unrelated personnel, close window, and negative procedure, negative pressure room if possible. Remove these dispensable equipment, and cover the AC vent with chlorine releasing agent, and close the room door, and clear sign, avoid anti-accident, and divided contaminated buffer and clear zone. And during the operation, the medical staff need to safety goggles and face shaders, should be level 3 protection, and other procedure have there. And the post-operation procedure also need to pay more attention and get rid of the last layer of glove and head, face shield, surgeon gown, and shoes cover at the operation room, that is a contaminated zone. And also the other things like I already showed here, and delivery management need to pay more attention, and pre-delivery prepare and protection during delivery should be pay more attention. The surgical mask or N95 mask for the pregnancy woman should always on. And if in labor and might delivery quickly, immediately, need co-support assistant in clear zone, avoid cross contamination, and quarantine on spot. And the important things also is equate level 3 protect gears at every place. And post-delivery sample collection also need to use the exclusive transfer unit, and follow the infection management orders strictly. And post-delivery need to sterilize. And please remember, the devil is in the details. Establish emergency plan, sort of the key issue, make much effort to ensure the safety of pregnancy women and infants, and prevent and control the spread of virus in all links. And postpartum care and protection of neonatals also needed. And now we suggest the mother should not not feed until the mother's isolation period is completed, and neonates of mothers with COVID-19 should be isolated in the designated unit for at least 14 days after birth. Of course, it's difficult to the mother and neonatal, but give more safety. And what is the vertical transmission from mother to baby? I already talking about it. It's not sure, and this Lancet papers all sample test negative for the virus, for amniotic fluid, cord blood, breast milk, and neonatal throat swab sample. And others also the reported 10 cases of neonatal swab sample test negative for the virus. And even there is IgM positive report in the 3 cases because the neonatal COVID-19 nucleic acid or test is negative, and IgM acid can be prone to false positive and false negative result. And also the rapid decline reported in this patient could represent artifact. So the point most specialists is not sure the SARS-CoV-2 be transmitted into in uterus. Of course, the 2 letters published in the JAMA show the mothers suffer from coronavirus. The antibody IgM is increased, and cytokine tests were abnormal in the newborn 2 hours after birth, and others is also IgM was detected in 2 infants. So we need to pay more attention to even the case as a vertical transmission from mother to child remain to be confirmed, but as important to shorten the delivery time of fetus and minimize the contact between fetus and mother blood and body fluid during cesarean section. We need more definitive evidence. And what can the pregnant woman do to prevent virus and protect herself is important. Reducing the risk to expose an infection is easy to do, and also is difficult to do. For the home quarantine, avoid close contact, wear mask, wash hand, sanitize the room, and self-monitor. And the prenatal check-up recommendation should the pregnant woman know the context and the interval of prenatal check-up, and under 28 gestation weeks with no discomfort, and check-up can be extended appropriately. Monitor fetal movement and symptoms at home. And after the 28 gestational weeks, proceed the regular checkup as recommended. And high-risk patients should go to every schedule checkups. And the first thing for the infected pregnant woman need to do is go to the designated midwifery medical institute for treatment as soon as possible. And the other recommendation is a psychological intervention. And Shanghai, they do a survey about 2,000 pregnant women, and more than 90% worry about being infected. So they are nervous and need to help them. And something about the ART, I don't mention much because some countries suspend all non-urgent care, including the fertility treatment. In China, we suspend fertility treatment in epidemic area like Wuhan, but like Beijing and other province control well. We don't suspend outpatients, but reduce the number of outpatients to a large extent, and should be treatment the patient, outpatient or inpatient, just like the obstetrician already done as a reproductive team doctors. And important things as proceed in an orderly way and step by step, and feedback problems in time, and epidemic prevention remains the top priority. And finally, I emphasize 4E and 4P. Early identification, early reporting, early isolation, early treatment is always important things for the critical issue for protecting pregnancy women or the ART patient. And also very important for P, protection of pregnancy women themselves, and family member protection also is important, and health worker protection, of course, very important, and the other things should be emphasized for the hospital and environment protection. And of course, we face difficult condition. We don't know how long will last, but let's all the sacrifice not be in vain, and even we apart far, but close at heart. We unite together should be win the battle. Thank you, everybody, as patient. We unite together should be win the battle. Thank you, everybody, as patient.